It's Sunday, November 16, 2025, 1 p.m. Central Standard Time here in Champaign, Illinois. You're watching Co-op for Two. You're joining me for the second patient, actually the third if you count the tutorial, in Miami Flatline, a game in the Medical Mysteries series. The second box they make, the second box we've played. We played Patient 1 and the tutorial case yesterday. We saved our patient. Little hairy for a moment there. So I am happy to see the channel full of our regulars to help me today. I'm a little nervous about... This game makes me a little nervous because I do not want to lose a patient. There are only a handful of cases, and if we fail one, it's not a good feeling. And Paul Grogan of Gaming Rules has stopped by the chat. Okay, so today we're going to play Patient 2. Let's see what we're in for. We played the tutorial yesterday. I was actually just watching Paul Grogan's coverage of Agammonia, which Stacy sent me. And it is a serious looking game, but apparently it's not that bad compared to some others, but it's a big intimidating box. It's hard to get those big giant boxes to the table because they take so long to set up. It's got a whole sheet telling you how to put everything away, but I have heard good things. Paul likes it. So we are going to give it a try soon. We still have to finish Flashpoint Legacy of Flame first. All right, so Patient 2. Let's get out our materials. I watched yesterday one battle after another. Has everyone seen that? I did not. I was not a huge fan of it. People are glowing about it. I really like Leonardo DiCaprio as an actor, but that movie did not do it for me. Oh, we don't want the epilogue. Don't look at that. All right, we know how to play. We don't need that. And we don't need that. We've got our intake, interview, and report, and we've got our log, and we have our medical information. All right. So, are we ready to start? Paul says agamonia is amazing. Is it? It's agamonia, right? Not agemonia. I guess agamonia makes sense. Yeah, one of the reasons that agamonia appeals to me is I was just talking to Stacy, who sent it to me. Their group bounced off it. That's the term of art we use when you start a game and you decide to stop playing it. And I don't remember why she stopped, but the main thing that I am trying to avoid, I love big, long campaigns. I love anything, the legacy stuff, but it's the grinding that causes me problems. Like, I don't want to do huge amounts of fiddly combat stuff and play many missions before I get to some new story, narrative, and exploration. I really want to do the exploration and narrative and a little bit of combat. Paul says, if you ever have any questions about agamonia at all, just ping me directly. Okay, I appreciate that. It looks amazing, and the box is just stunning. All right, I like the style of the art too. All right, are we ready to get started here? Any thoughts after sleeping on our previous case? Combat is not the main focus. That sounds terrific to me. Okay, so yesterday's case, we had a girl with something up her nose, and we had a choking hazard. She was bleeding. We did make things worse, but then we made things better. Debbie says, I wrote some thoughts in Discord. Yeah, Debbie was talking about how we love this game, but how some medical people that we've played with, or who I've heard have played it, have not loved it as much, and maybe that's probably to be expected. Any area where you're a professional in that area, the board game feels too simplified, too abstract. Some things are wrong, but in the mystery game space, there is so little coverage of medical mysteries. Just a handful of games. We've played this. We've played an autopsy game called Body of Evidence, which didn't quite work that well. But this is the star of that space. It is an amazing accomplishment. The mechanical system here works really well, and it is full of tension. Lots of things are done right here. But, okay, so this is patient 2. And the bad news is, after patient 2, there's just one more game session to play. And that's a combination of patient 3 and 4. Look like they're part of the same thing. Or maybe it's a continuing story. I don't know. But patient 2. Let's see what we've got here. Here's our intake interview with Mick Irons, a 70-year-old male. There's a ruckus in the emergency room as an old man is carried in by a group of 5 surfers who are loudly demanding attention. An orderly helps the old man into a wheelchair as the group swarms you. You gotta help. He fell off his board. He hit his head. You gotta do something. Hemingway's like a dad to me, to all of us. The first thing you notice is that the old man is missing his left arm. One of the guys says, Hemingway lost his arm in the Vietnam War. Doesn't slow him down surfing. You should see his sushi roll. Outstanding. Hemingway, you ask? You know, like The Old Man in the Sea. It's by Hemingway. Get it? Moaning, Hemingway holds his one hand to his head, his index finger swollen. He mumbles, unable to answer your questions. What happened, you ask? All 5 surfers answer at once. You point to one of the young women. Just you. She says, Hemingway was doing a tail slide when suddenly his legs went out from under him. He hit his head on the board. Flipper brought him back to shore. He couldn't stand on his own. We carried him to the van and brought him straight here. She pauses, thinking. It's been about 28 minutes since he hit his head. Is he going to be all right? Shut it, Pancake. The doctor's talking to Milky Way. You ask, any idea why he might have fallen? Has he fallen before? Did he eat or do drugs before surfing? Hemingway would never do drugs, says Milky Way. That's one of his rules. No drugs or alcohol. That stuff used to get us in trouble. He said he lived that way before the war. Losing his arm changed everything. He says you have to live life to the fullest. You can't do that if you're putting crap into your body. He does the carnivore diet, says Pancake. Lots of beef jerky, sometimes a burger patty, but no fries. He loves crab. He trails off as everyone looks at him. Have you noticed anything strange lately, you ask? One surfer says, he never complains about anything. That's not true, says Milky Way. I've heard him say he was feeling tired. He's been grouchy, too. Her eyes open wide. Wait, he said his legs felt weak. Everyone starts talking at the same time. You take the opportunity to get Hemingway away from the chaos by wheeling him to a quiet examination room. Take story card 1 and status card SC1, confused and in pain. Okay, so the big concern for us should be concussion, right? He's holding his hand to his head. He's fallen. His legs went out. He hit his head on the board. I mean, concussion is the primary thing to worry about because you can't see it. It's inside the head. You have bleeding in the brain or whatever. They look okay, like you hear about these sports injuries. The person comes off the field after a strong hit. They seem okay, a little bit confused for a minute, then they seem to recover, and then they die overnight. So concussion has got to be our first and primary concern. But then there's a little bit of a sign that maybe something was going on before that. It wasn't just an accident, right? He's been feeling tired and grouchy, and then he said his legs felt weak, but we don't know how long ago that was. Then a little bit maybe of a hint that maybe he's eaten some seafood, crab. He's got his carnivore diet. He loves crab, like some seafood. If they're eating, these are all surfers, maybe they're eating some fresh caught seafood. Maybe he's got something from that. But that's got to be way secondary concern to us than concussion. All right, let's take a look. There's our story card 1 and status card 1. I wish they would file these a little differently so that you don't accidentally see a status card you shouldn't. Okay, so he's coming in confused and in pain. Remember, all patients have 3 little time periods of 12 actions before our shift ends at 8 p.m. We've got to get him stable by 8 p.m. If we can solve everything, great. But most importantly, let's keep him alive through our shift so we don't get blamed. Okay, before we take a look at our options, let's take a look at questions we could ask. Okay, so he's a little confused. I guess we're not going to be able to ask him questions, but we could start asking his group of friends questions. These are weird because they're not questions, they're little details. So we could, little oddly, normally we've got questions. Here we've got kind of like answers. I thought for a second we weren't reading the right thing, but they're all shouted out, these details, and we could follow up on them. So there's a newspaper that one of them thinks is important and wants us to pay attention to. This guy saw the fall and was the first one to reach him. Pancake wants to tell you what he ate. Seagull can tell you about his finger wound. And Milky Way can tell you about his missing arm in the war. That hardly seems important. Let's look at his examination. In fact, let's start here. Okay. Here's the admittance exam that we're passed as we treat him. He's alert but confused. He's unable to get in. We're unable to get info from patient because he had a hard time staying focused and gets confused. Doesn't use drugs, so it sounds like this is concussion to me. Vitals are normal. No shortness of breath. Let's see. Movements intact. No yelling. No swollen gums. No cervical. No swollen lymph nodes. I guess that would indicate you're sick or something. But he's confused. Heart rate is regular. No murmur. Normal muscle and joint pain. No tenderness. Everything seems fine. Extremities. No leg swelling. Non-tender. Left arm amputation above the elbow. Right index finger appears red and purple and swollen with 2 bumps. Feels hot to the touch and is immediately withdrawn when touched. What exactly were we told his index finger looks like? He's missing his left arm. His index finger is swollen. And here we're told that right index finger is red and purple, swollen with 2 bumps, hot to the touch, and is immediately withdrawn. So it's hurting. But one of our people says what about it? Finger wound. Okay. So maybe he just, when he fell, he landed on it and broke it or something. Or sprained it. It's swollen and bruised. Doesn't seem like a major concern of ours. Let's take a look at his EMR. Okay, so everything's a little elevated here. He's got a little bit of a fever. Could someone convert this to degrees so we know how bad a fever it is? Heart rate's a little elevated. Blood pressure elevated. Lungs a little elevated. Breathing. Oxygen elevated. It's actually, these are pretty high. Like he's up here in the quite abnormal range for everything here. So I wonder if he doesn't have a bit of a fever from the shellfish. That's my, if I had to guess, my first guess here is that he's got some seafood poisoning and he's decided to go surfing and surf it off. And it's caused him to fall and hurt himself. So let's see. Debbie says, I'm concerned he may have had a stroke or something. Interesting. Finger not looking good. Look at those vitals. He has a slight fever, maybe some kind of infection. Isn't blood pressure low rather than high? I guess we're going to have to check those against normal. Nelson says this is 101. So he absolutely has a fever. So he hasn't just fallen. He's got something wrong. Probably, I'm guessing seafood sickness, but it could be anything. But he's definitely got a fever. Shouldn't have been surfing. But look at his oxygen is all messed up. His breathing is a bit messed up. Okay, let's see. Head concussion. So they've noted here on his chart, he's got a concussion and head pain, confusion. He's got a finger wound here. He's got an amputated arm. His back is sore and has some pain. His legs are weak. He has ataxia, a movement disorder. No recent travel, no recent illness, no medications, allergic to gluten. Left arm amputation, pre-existing chronic kidney disease. Okay, so kidneys are used to, this is an interesting tell, right? Kidneys get rid of toxins from the body, so maybe he's going to be more susceptible to something like a seafood neurotoxin. His body can't get rid of it fast enough. Single and lives alone. Debbie thinks the infection might be from his finger. That's an interesting possibility too. It would help to know whether that finger injury is old or new. So maybe you would say that puts a higher priority on learning about his finger wound. Probably we don't care much about his fall. He falls, we know his legs have been weak. He falls, he hits his head, he gets a concussion. Whatever this guy tells us about what he said and what happened is probably irrelevant. I guess you could say it might be important to know if he spent much time in the water, like did he lose consciousness and drown or something, but probably of our least important question. What he ate could be important, his wound, and then maybe this newspaper could say something about like bad seafood. So I guess if I had to rank these questions, they would probably be 4, 3, 1 or 4, 1, 3. And 2 and 5 of least important. Debbie says, I'd ask about the finger in the fall. How he fell might tell us something. I suppose it might, except for the fact that this person said he's previously mentioned his legs were feeling weak and was doing a tail slide. Suddenly his legs went out from under him. He hit his head on the board. I mean, it feels like we know as much as we need to know about that. All right. Is there anything we want to start out doing? I guess we're going to start by asking a couple questions. The newspaper could be definitely could be about people getting sick from recent food, or it could be a story about our guy, 7 years old, kidney issues. Okay, well, let's start by asking his friends a couple of questions. Let's think like doctors for a second here. Remember that you don't have to ask them questions right away. You can ask them questions at any point. And if our primary concern isn't really the infection, and maybe even it's not like what the problem is important, but the most important thing for us is the concussion. So let's just pause for a second and look at what the treatment is for a concussion. Right? Because that's, I mean, it's nice to know what happened. We want to solve a mystery, but lose the ability to filter waste. So I do think his kidney disease could be responsible for him, his infection getting worse. But I'm more interested in concussion at the moment. Brain injury, usually caused by blow to the head, can result in loss of consciousness. Effects are usually temporary, but can include headaches, difficulty with concentration, memory, balance, and coordination. People typically recover fully after a concussion. Okay, so this document seems to be downplaying concussions. It's like, yeah, people usually get better. What would you do? What would you do if someone came in and you were worried that they had a concussion? How long has it been? I think they said about a half an hour, right? Now, he's still confused a half an hour after this concussion. It's been about 20 minutes since he hit his head. Okay, so not a half an hour, 20 minutes. But I'm a little worried about... Okay, look, imaging or testing depends on the cause. Stroke or traumatic brain injury, immediate head CT scan. That's what I think we do. I think the first thing we do is we CT scan him. Cerebral microhemorrhage. Microbleeds in the brain can cause confusion. There are often no symptoms. This is the concussion where the person looks okay. As long as the patient's cognition improves, blood pressure is stable, there's no need for treatment. They usually resolve on their own. In some cases, surgery to drain blood from the brain. So I think when someone like gets a hard injury on a sports team or something and has a concussion, what they generally tell you is like monitor them very carefully. And if they show any signs of getting worse, like they start to get confused, then you go right to the hospital emergency room because they might have swelling and bleeding in the brain. He's not showing any signs of a stroke, although weakness of limbs, slurred speech, confusion. No real slurred speech. His back hurts. But he could have gotten injured in other ways. But I think maybe we got to do a CT scan on him to see if there's anything serious. Where's our CT scan procedure? Let me look at tests for a second. Here's our CT scan. More detailed conventional X-ray. First imaging choice to identify disease or injury, particularly complex bone fractures, several eroded joints, can detect tumors or lesions, and head trauma, blood clots. However, some soft tissue conditions such as ulcers. I think we set him up for a CT scan right now, and then we'll talk to his friends in more detail. Let's worry about worst case scenario. If he does have a shellfish infection, it's obviously wasn't so bad 20 minutes ago that he couldn't go surfing. That's not killing him immediately, although I guess he could have gotten stung by some poisonous jellyfish when he hit the water. But he's not going into shock, he's just confused. There's a wound worth confirming he doesn't have sepsis. He's alert, he's just confused. And his friends are speaking on his behalf, yeah. If there's a wound, it's worth confirming he doesn't have sepsis. How fast is sepsis going to trigger? Let's read and remind ourselves what sepsis is all about. But I think he's going to get a... Can you imagine if you were real medical people, you could play this game and then play it on like a time, play it with real time limits. So you have to make every decision every 10 minutes. We take our time here. Where is our conditions? Let's see if we find sepsis, which is being talked about here in the channel. Extreme response to infection throughout the body. Symptoms include high heart rate, weak pulse, confusion, extreme pain, fever, shortness of breath. Infections that lead to sepsis most often start in the lungs, urinary tract, skin. Sepsis is life-threatening. Treat with antibiotics and IV fluids as soon as possible. Huh. Extreme reaction to an infection. That's interesting, but is he having an extreme reaction to an infection? Surely not within 20 minutes. Like, he was well enough to surf, he hit his head, 20 minutes later he's here. Surely he hasn't gotten injured since in the last 20 minutes that's triggering sepsis. His hand is all swollen. It's obviously, I mean, we should find out about the hand, but let's get him in for a CT scan first. All right, so we're doing a CT scan. Where's our list? I mean, I guess let's review this first. Okay, we've got, our choices are to interview the witnesses. We could do blood tests. We can have an MRI on his spine. He does have back pain. Or we can do a CT scan on his brain. That seems more likely. An MRI in his brain. It feels like CT scan is the way you go with the brain. He does have back pain, though. Sore back. Sore back. That's not like extreme back pain. He is in a wheelchair, right? But no sign that he couldn't walk. Could x-ray his legs. We could do blood transfusion, dialysis, dress his wound. We can do a tissue culture on his finger. Trepanation. What is trepanation? Sounds familiar, but I can't remember now. What do we want? We want treatments. Procedures. Trepanation, making a burr hole, drill into the human skull to help relieve intracranial pressure where fluid build up. Okay, so it's quite likely we may have to do trepanation if the CT scan shows swelling in the brain. We don't have to worry about it now. Aspirin, no, he's in too much trouble to be dealing with pain relievers and aspirin. But maybe you give aspirin right away when you think someone has a concussion. No, first we go CT scan. Maybe he's going to need antibiotics. Dermatologist. Where's our drugs? Let me just see if they don't recommend you give someone a blood thinner right away. Reduce pain, fever, inflammation, blood thinners to reduce chance of clots. I don't think so. I think the most important thing is CT scan. Okay, let's get ourselves into a CT scan. We'll give him a CT scan while we talk to his friends. Okay, CT scan on the brain at the earliest block of time gives us ECM. The chat is telling me you don't give someone aspirin in case there's bleeding in the brain. Okay, let's see what we've got here. CT scan. ECM story card 27. The neurologist looks at the brain CT scan. I assume you're concerned about a hematoma because he struck his head. He says, not to worry. His brain looks normal. That said, your patient might have microbleeds that are too small to be seen on a CT scan. If you want to be sure, try a brain MRI. Microbleeds that are too small to be seen. Okay, well, we've done a CT scan. What do we see? We see he doesn't have major trauma to his head. A little bit of a surprise there. He says you could do a brain MRI if you want to look for microbleeds. So, as long as the patient's cognition improves, blood pressure is stable, there's no need for treatment. So basically what he's saying is, okay, he doesn't have any major trauma. There's no huge brain swelling. He could have some issues though with microbleedings, but those normally take care of themselves. So I think that danger is over. Something else is going on. So our concern is infection or neurotoxin. I suppose from a detective standpoint, we shouldn't be saying, well, that's a crazy coincidence that he hit his head and yet his infection has become acute all of a sudden. Like that's not a coincidence because one is the cause of the other, right? A fall doesn't trigger an acute sepsis reaction to an infection, but the other direction is quite plausible. That is, he had an acute reaction to sepsis to an infection that have suddenly gotten to his brain and caused confusion, and that caused the fall. So even though it looks like the immediate presenting problem is he hit his head and got a concussion, it's actually the other way around. He suddenly let his infection get out of control, and that's caused him to fall. Of course, he may have also hurt his back badly. We don't know that. It would be kind of nice to know that before we start moving him around, but I guess it's not like Not like he's complaining of severe back problems. Fall, hit your head on a surfboard in the water. Unlikely to break your back. All right. Are we likely to get better information talking to his friends or doing tests? Okay, we've got two candidate thoughts about his infection. One is it's something he ate, and the other is that it's from the finger. So one would be an infection in the finger, but finger could get infected by something in the water too. We are in Florida. You could have brevetoxins, toxins produced by algae found in Florida red tides, contaminate certain kinds of shellfish that when eaten can cause neurotoxic shellfish poisoning. Symptoms are abdominal pain, nausea, vomiting. He doesn't seem to have displayed any of those. Vertigo. Onset of symptoms occurs within minutes of consuming. People recover within 48 hours. So he really doesn't need to be treated for that. Although he has kidney disease, so he can't get rid of it. So he actually might be more susceptible. Kidney problems, IV. Neurotoxic shellfish poisoning caused by consumption of shellfish, clams, oysters, mussels, etc. that are contaminated with brevetoxins. If it's sepsis, we treat with antibiotics. Surfers, myelopathy. Spinal cord injury, common in beginner surfers. Symptoms include leg weakness, back pain, numbness, and paralysis. Diagnosed with a spinal MRI. So he does have weakness. He has a back injury. And he had leg weakness. So another possibility is that he's hurt his back at some point prior to the fall. But no sign of paralysis. Well, we might want to put a spinal MRI on our list. Let me just look at our tests again. Do we have tests for neurotoxin? What do you do if you think he's got neurotoxins? I guess maybe we should ask some questions of his friends now. Well, okay, what does the chat think? Let's see. Debbie says, if he ate something bad, wouldn't we expect stomach problems? He's got very low blood pressure. Huh. That's interesting. Why does he have low blood pressure? So acute kidney failure, high blood pressure. So if you thought he might have brevetoxins from shellfish, diagnose by testing urine for brevetoxins, but there's not much you can do about it. Okay, there's a lot of noise going on outside my office here. Don't know what's happening. Where's our tests of urinalysis? I want to see what else we would test for. Maybe we should just ask some questions. He has a fever, which is normal with infections. That's a good point. So there's no urinalysis even available to us. So it looks like maybe we should be doing a blood test for. How do we find out if he has an infection? Blood alcohol, kidney function, blood sugar. Oh, interesting. Normally, what do we do when we suspect a bacterial infection? Don't we do a urinalysis or something? But we don't have those options. Angie says a CBC will show infections. Complete blood count uncovers conditions such as anemia, blood loss, infection, and leukemia. Okay. So a CBC might give a sign of an infection. Chat is a little bit split here. CBC. A complete blood count test. That would show infection. How do we do for, I mean, we could test specifically for neurotoxins. Can we do a test for neurotoxins? What were we told that, where is my button for too much noise outside the office? Okay, we did see, I apologize for taking so much time here on this first thing, but I guess we want to be as efficient as possible. So if we think he's got shellfish poisoning, that's the brevetoxins, and brevetoxins would have occurred right away, and we would test the urine, but we don't have that, so we don't even have that option. All right, I think having ruled out concussive, serious concussion, maybe the logical thing would be to find out a little bit more about what he ate and his finger wound. Those are our two primary things. The immediate danger of concussion is over. I think we're going to ask questions. Okay, so we're going to ask question 3 and question 4. What did he eat and what's up with his finger? So YCW and UMG. And then we'll get a blood test going. Debbie says, could I look up sepsis again? Sure. Here's sepsis, an extreme response to an infection throughout the body. Symptoms include higher heart rate, weak pulse, extreme pain, fever, shortness of breath. Infections that lead to sepsis most often start in the lungs, urinary tract, skin. Sepsis is life-threatening. Treat with antibiotics and IV fluids as soon as possible. So we could just put him right now on antibiotics and IV fluids if we're worried about an infection. Could do a blood test to see about an infection and then put him straight on that. Maybe that's better than asking the questions. Blood test. We do have time to do the blood test and antibiotics. Do you think we should do that instead? Seems more logical and realistic that we would ask a couple of these questions first. Okay, let's stick with our guns, but we might jump to... I'm guessing we're going to do a CBC, and then we're going to do antibiotics and fluids based on that. Antibiotics and fluids. Do you just give antibiotics without doing the... All right. I'm going to role play this a little bit. I think from a game standpoint, we probably do a blood test and then have time to do antibiotics before this update. But I feel like realistically, thematically, we should get a little bit of background information on this story. So we're going to stick with this, even though it might be slightly inefficient. All right, so we're going to start with YCW and ask some questions. YCW is story card 5, and UMJ story card 5 and UMJ is story card 6. Okay, let's see what they say. So first we're asking about what he ate. Pancake is a young man who never seems to take a breath while he's talking. Hemingway doesn't mess around when it comes to his health. He's always talking about the benefits of the carnivore diet. He's got iron willpower. All he eats is beef and crab and shrimp. I don't think I could do that. And no alcohol or cigarettes, not even a vape or pot. He catches his own crab, too. He shares them, and they're incredible. I think he got bit by one of the crabs. Bungie thinks the crabs poisoned him. But he shares them, and they're incredible. So it sounds like maybe they all would have gotten sick if it's a neurotoxin that he ate. However, he got bit by one of them. That sounds like maybe that's the infection in the finger. And that is more likely what's caused his infection. And maybe we're going to find that out now. Yeah, look at that. 2 different ways to find this out, it seems like. While the youngest, Seagull is also the most serious of the bunch. She has a piercing gaze and never breaks eye contact with you. I asked Hemingway about his finger when we met at the beach this morning. He told me he went crabbing yesterday and a crab caught him with its pincer. He laughed and said he paid the crab back by eating him. The wound seemed fairly serious to me, but Hemingway just laughed it off. He didn't even cover it with a bandage while we were surfing. He said he's been through worse and it's going to take more than a crab bite to stop him from hitting the waves. Okay. So it sounds like we have our most likely culprit here. An infected crab, perhaps with some parasites or neurotoxins that he ate and cut his finger, which he has left not even covered with a bandage. So what have we got? I guess we've got possibility of neurotoxin, but much more likely an infection. But possibly not a bacterial infection. Possibly not a bacterial infection. Could be bacterial infection, but also could be parasitic infection. He ate it, and it cut his finger. I think it's too late for dressing a wound. The question is, do we put him immediately on antibiotics? And do we know which antibiotics? Right? I mean, this is an interesting little sub-question. On our choices of what to do, we could just give him antibiotics, but we don't know what antibiotics. I wonder if we should do a tissue culture of his finger. Let's look at our procedure for tissue culture. Yes, there's no entry for tissue culture. But it feels like maybe that's the way to go. So should we do a blood test or should we do a tissue culture on the finger? And what will the tissue culture tell us? We don't really have an entry for tissue culture. So we don't really know what it will tell us. Look under procedures. Yeah, that's when I was... Oh, tests. Maybe it's not under tests. Maybe it's under procedures. Oh, good. Tissue culture. A method where you take a sample tissue from the skin of an organ to analyze in the lab for infections or other defects. I think maybe that's what we should do. We suspect strongly the finger is infected. The only question is whether we should just jump straight to antibiotics or whether we should culture it. Okay, it feels to me like that's our cause. That's what we should do. Let's do a tissue culture on the finger. That's our number one suspect now. That will at least tell us, well, it wouldn't rule out neurotoxin, but it might be the best way to get two pieces of information. Okay, we're going to tissue culture. the finger. I think that's the way to go. PMV. Any objection to that? Maybe that'll give us more specific information about the kind of bacteria. Yeah, then we'll know how to treat it. I think that makes sense. That might also give us an indication that if he ate it, he would have neurotoxins as well. Okay, this is what we're doing. PMV. PMV story card 28. Let me remind you that just because he didn't have a concussion doesn't mean the game won't reward us for worrying about that. All right, here we go. As you cut tissue from Hemingway's swollen finger, he winces in pain. For a moment, he seems to be able to focus on you before dropping back into a daze. Normally, it takes hours to get the results for this test, but as your hospital has an on-site facility, you get the results promptly, and it's a good thing you did. Hemingway's finger has been infected with Vibrio vulnificus. Take status card S2 infected. Okay, so we made a very good decision because we got what we were hoping for, a very specific identification of what has infected him, which is much better than just giving him blind antibiotics. So his condition has changed. We now know he's infected. However, before we can make another choice of how to treat that and learn about that, we have to trigger his update at 1400. WGC. And just out of curiosity, his status would be different if we hadn't figured that out. So WGC, let's see what the update is. All right. Hemingway's condition is more serious than expected. You know you need to act fast, but you also need to proceed with care. You take a deep breath to ground yourself and catch your bearings. Wow, that's weird. WGC. Okay, his condition has gotten worse. But now we know what it is that's infecting him. Vibrio vulnificus. Okay, someone might want to look this up online, but we're going to find an entry in our documents here, surely. But why don't we take a break first? I'll see you in 8 minutes. We'll learn about this infection that he has. So it's 2 p.m. Our patient, Hemingway, otherwise known as Mick Irons, has come in confused. He hit his head, fell down on his surfboard. We did a CT scan, worried about concussion, traumatic brain injury. That was fine. We noticed he has an infection on his finger. We talked to his friends. They said that he ate a crab that he caught that also had bit him on the finger, and he didn't really treat the wound on his finger. So could be neurotoxin that he ate, could be viral parasitic infection from the crab, or it could be that he just didn't treat the wound and it got infected from the air or something. So we did a tissue sample on his finger, and we actually found what seems most likely is the cause of all his trouble here, which is the tissue sample diagnosed the specific bacterial infection. Or sorry, the specific infection, I should say, is Vibrio vulnificus. So let's go and look at what Vibrio vulnificus actually is. Here is the entry. It's a bacteria, so it is a bacterial infection, can cause life-threatening infection, often contracted by eating raw or undercooked oysters and other seafood. We don't know if he cooked it well and killed it off when he ate it, but it can also infect open wounds. I suppose it doesn't matter how he got it. It's not a neurotoxin, so whether he ate it or not is irrelevant. Just, I guess it would affect the load of bacterial infection that he has. But he certainly got it in his skin, in the wound. And what it's continuing to say, isn't there more? Yes. Could also infect open wounds that come into contact with raw or undercooked seafood, salt water or brackish water. 1 in 5 people die. Wait, that's of necrotizing. Is that the end of it? No, that's a comma. Is it continuing here? I guess this is the continuing. 1 in 5 people die of necrotizing fasciitis, often within 2 days. Okay, so this is what we should worry about him dying of, necrotizing fasciitis. 2 days after onset of infection. Okay, we know this happened yesterday, so it's already been a day. Now, diagnosed with tissue culture, which is what we did, treat with antibiotics, doxycycline, and ciprofloxacin. Then immediately debride all dead tissue to prevent further spread. Okay, so I want to point out a couple of things, and then we're going to talk about this for a minute before things have gotten worse. It's 2 p.m., but it's still early in the treatment. Okay, so first thing to point out is that when we were looking at him earlier in the day, right when he came in, we said, after we did the CT scan, we said, well, it's probably an infection. And we wondered, should we just give him antibiotics? And one of the comments I made was, well, that would make sense, but there's so many antibiotics, we don't know which ones to give him. And now we see the wisdom of figuring out what it is first, because it feels like if we had chosen to give him antibiotics, maybe the game would have said, well, what do you want to give him? I guess maybe you give him a broad spectrum of antibiotics. But now we've got very specific set of antibiotics. So probably we're going to give him antibiotics right away. That's the next step. Obviously, get those antibiotics into his system as fast as possible. It says, then immediately debride all dead tissue. So his finger has been infected for a day. The question is, how much of his finger are we going to have to take out? But, so it seems like we've got our next two actions set aside for us. Let's see. It's antibiotics and then debridement. Now, that seems fairly straightforward as our next set of actions. I just want to raise two additional things before we continue. The first is that we are told what people die of when they get this. Okay, so I think we know what we want to do. We want to give him antibiotics and debride that finger so it doesn't spread. And maybe we may have to talk to an expert about removing the finger completely. But I guess when we debride it, maybe we'll get an idea. But I do want to think we have another piece of information of what people die of. Necrotizing fasciitis. I think that's going to be about the skin dying, but we might want to look into that and look into how do you best diagnose and avoid people dying from that. Given that he lost his arm, he doesn't seem too concerned. It feels like if he had a choice, he'd be like, take the finger rather than risk. So we might, if we had a choice, it seems like better to lose a finger than die. This is a very serious infection. 20% of people die from it. So better to just take the finger if there's any doubt. Angie says it's a flesh-eating disease. Yeah, it sounds like the when your flesh dies. So I think we might want to look that up. Now, here's the other piece of information I want to remind us about. One of the key things we want to be on the lookout for is when things are contraindicated, like where we might treat something one way, but we should do differently. And that was his intake interview about his kidney issues. Let's look more detail. Swollen with 2 bumps, hot to the touch. So where is his background of kidney disease? Chronic kidney disease. So I want to make sure we don't give him anything that's going to tax his kidneys, or that any decision about the risks are increased because his kidneys can't get rid of toxins. In this case, it doesn't seem like it's a toxin. It's a bacterial infection, so probably that's not relevant, but it might be relevant for what we give him. If we wanted to look up what he's been infected by, here is Vibrio vulnificus. Remember, this game doesn't require you to use the internet, but it might for some of these things. Its ability to cause severe wound infections and sepsis and rapid tissue necrosis, death of the tissue, and the formation of fluid-filled blisters. That's his 2 bumps on his finger, the fluid-filled blisters that can become gangrenous. So basically, it just kills the flesh. Gram-negative. Particularly for those with compromised immune or liver disease. Okay, well, he doesn't have liver disease. He has kidney disease. But this is serious. What does gram-negative mean? Motile, that means it's moving around. This game is going to give you paranoia about, I mean, I don't want to go in the water normally, but I certainly don't want to go in gram-negative. What is gram-negative? Can someone fill us in the chat? They're halophilic because they require salt. So that's why they're in salt water. Do we have a choice of antibiotics? Does one of them stress the kidneys more than others? Debbie says, I don't think we have a choice. We don't have a choice yet, but I think if we had chosen this, well, just take a look. This is an interesting look behind the scenes at the game. Before we knew what caused his problems, antibiotics, HBV, now that we know it's the same entry. But when we look up that entry, it may ask us what we should give him. Debbie says, do we need to read the 2 p.m. status update first, or was that the infected card? We did read the update, but I can read it again since it's been a bit. So the status update at 4 p.m. was WGC, and it was just telling us, it was actually telling us to take things seriously. So here's the status update. Hemingway's condition is more serious than expected. You know you need to act fast, but you also need to proceed with care. You take a deep breath to ground yourself and catch your bearings. So basically, it's telling us time is of the essence. So we're going to give him antibiotics and we're going to do debridement. There's no doubt about it. I just don't want to make sure. I think we just better make sure we give him the right antibiotics. The chat says, from Wikipedia, gram-negative bacteria are bacteria that, unlike gram-positive bacteria, do not retain the crystal violet stain used in the gram staining method of bacterial differentiation. So it's just a way to classify large groups of bacteria based on how a certain test. But Angie says gram-negative is also more resistant to antibiotics. They pose significant challenges in the medical field due to their outer membrane, which acts as a protective barrier against numerous antibiotics. Okay, I'll bet you this game is going to ask us which antibiotics to give him. So basically what's happening is that they have an outer barrier that's protecting them from getting stained, and also is protecting them from some antibiotics. That makes a lot of sense. All right, well, we know what we're doing. We're giving him antibiotics, and we know what it is, so we know which antibiotics to give him. Hey, here's an idea. We know he's got kidney disease, right? And I kept saying maybe that's important. It is interesting that this gives you 3 choices. Where was our... No, it was here. So do you think that we might want to look up these 2 drugs to see if one is better for the kidney or one would be better in his situation? Let's look up drugs here because that would be pretty cool. Already we know we're going to give him certain drugs because of what bacteria it is. But, okay, ceftazidime here treats many kind of bacterial infections. Note this is not the same as ceftriaxone. Okay, so the other option though is ciprofloxacin. And here is Simidine. No, that's not recommended. Okay. Here's ciprofloxacin. Treats certain bacterial infections, can cause adverse side effects, including diarrhea, vomiting, and nausea. So ciprofloxacin is preferred, if appropriate. Avoid if patient either had seizures, epilepsy, cerebral sclerosis, narrowing of blood vessels, stroke, or kidney disease. How do you like that? How do you like that? That's why we know. That's why this team got called for this job. Look at that. We've noticed he had kidney disease. I said, let's be careful and look for contraindicated drugs and treatments, and bingo, we got one. This is one of the drugs they recommend for treating this dangerous bacterial infection, but we've got some choices here, and this is the antibiotic we want to avoid, and you can bet that when we give him antibiotics, even though we don't have a choice when we make this decision, you better believe it's going to ask us which antibiotics to give him. So not only were we smart to diagnose it, but we were smart to say, he's got kidney disease. Now let's just look at the, what was our alternative? Was here. Okay. And then doxycycline. Let's check doxycycline. Treats certain bacterial infections used with other drugs to treat infections caused by this one. Okay. All right, so there we go. Now let's take a moment to have everyone tell me that I did good. Well done, says Nelson. Trap right there for sure. Any lesser doctor would have marched straight into disaster. Thank you. Okay, here we go. So we're going to give him his antibiotics, HBV, and this is surely going to ask us which antibiotics. I don't have a doubt in my mind. HBV is story card 30. Bingo. You can give Hemingway one or more antibiotics with the IV fluids. Okay, we can give him one or more. Choose as many antibiotics to give him as you like. Mark all your choices on the patient form, then look up the result for each of your choices. How good is that? Come on. How good is this game? It's such a flexible system. Okay, so we know that with this bacterial infection, we want to give him two of the drugs. We want to give him cefadizamine and doxycycline. So we're going to give him antibiotics and just the fluids help in general. And we're giving him the first and the third, but we're not giving him ciprofloxacin. QCH BDJ. A very quick, probably start with the doxycycline. All right, we'll reverse the order here. A very quick game design note here. You can get this card if you get this card no matter when you decide to treat him. And even if you didn't know what it was, this feels like it's giving away too much information. Like, even if you hadn't thought of anything, you would just look these three up in this book, and then you might say, oh, now I'm thinking of doing this. Probably if they wanted to make this a little harder of a game, which I would have appreciated, is if they didn't give you these, but if they just said, write down what antibiotics you want to give him. Because we would know to give him this one and this one, even without a multiple choice. So I feel like it's giving away the game a little bit more to give you this list of three. But I guess if you didn't know it was the specific bacteria, maybe you wouldn't know which of these. Maybe you just give him one. But it would be better if it listed all the antibiotics or just said, we're about to give him antibiotics, any special instructions. All right, doesn't matter though. Let's look these up. I'm going to look up BDJ first. We're going to give him the doxycycline first. Okay, BDJ is, there's no immediate effect. It will take some time for the medicine to take effect. And now QCH. We'll get graded on this at the end. QCH is, there's no immediate effect. It will take some time for the medicine to take effect. That's interesting. So that's pretty cool. No matter what you give him, it just says, that's going to take some time. Okay, so probably when we read this, it's going to ask us to what we gave him. Joji says, hey, it does say that cefadezimine should be given with care to people with kidney problems too. Yeah, but we got to stop him from dying. But are you saying we shouldn't have even given him that one? Did we make a mistake? Treats many kinds of bacterial infections. Okay, not according to this list, it doesn't. Maybe in real life it does. But this, in this rule, in this abbreviated version, it doesn't. Now look at this. Not safe for use by pregnant women. Don't you think you'd want to put that higher up? Okay, so don't give... Boy, look at... That's a little lawsuit waiting to happen. If we, in a future game, make sure that we don't give amiodarone to pregnant women. So these, you should clarify... It, when you say it says, you might mean the internet, but it certainly doesn't say in our rule book that it does. By the way, one quick comment that just occurred to me. We often see fan-made cases for games like Sherlock Holmes Consulting Detective or Chronicles of Crime, but here's the thing where people could write fan cases for this game that used the information in these booklets by writing your own cards and cases. In fact, I think people should. I think someone should be writing some fan cases for this game that uses this information. Okay. Let's debride that finger while we're waiting for the antibiotics to kick in. And if we have a choice, I would just remove it. Okay, debridement. Debridement, that's a fancy term for basically we're just going to cut off huge amounts of his skin. Right? That's debridement. Debridement is a nice word for removing all tissue that looks like it possibly could be infected. Where's our procedures? Let's just read what it says about that. That's got to be an ugly, scary looking process, debridement. Especially with something that's so dangerous. Surgical procedure for the medical removal of dead, damaged, or infected tissue. Examples include removal of calluses, treating some snake or spider bites, burns, tumors, or serious infections. A surgeon may decide to debride a portion of surrounding healthy tissue to ensure the affected tissue is completely removed. Well, that's what we're going to tell our surgeon. Just take as much of that finger. It's been 24 hours. So we can't fuck around. I just take his whole finger. Try not to take the hand if you don't have to. But this guy's been through worse. Take whatever you got to take to ensure he doesn't die. And because of his kidney disease, he can't tolerate that much antibiotics. So basically, he's not going to have a second shot at this. And he's 80 years old. So we can't fuck around. Just take that whole finger, take the whole hand if you have to, but better not to since he's only got one hand left. XVB, story card 12. Let's see if it gives us a choice. Do you think it's going to give us a choice about how much to debride, how aggressively to debride? Using your scalpel, you cut into the infection to see how bad it is. It oozes pus and blood. As you explore the wound, you find that the flesh around the wound has died and your worst fear is realized. Hemingway has necrotizing fasciitis. Antibiotics alone won't be enough. You need to completely remove the dead and dying tissue to stop the infection from progressing through his entire body. Angie says, wouldn't we want to preserve as much healthy tissue as possible? Well, I mean, yes, in an ideal case, but this 80-year-old guy who's had this infection for a full 24 hours could die from this. So I think, given the choice, better safe than sorry. I mean, maybe if this was a young, healthy kid without kidney disease, we would more aggressively treat it with antibiotics and sit and wait and look at it. But I don't think this guy, I think we got a really better safe than sorry. 80 years old. Like, let's just keep him from dying. So it says basically we're continuing. He absolutely has necrotic fasciitis. Wow, look at this. Okay. Before you continue, you mark Hemingway with a Sharpie marker to show exactly where you want to begin cutting. Look at that. He's already lost one arm in the service of his country. You want to make sure you're not taking any more of his remaining arm than you have to. To consult the infectious disease specialist first, use an extra action. So look how cool this is. Okay, I gave him an extra decade. He's 70, not 80. Still. Okay, so look at how cool this is. Now, this is tricky because we've got a situation on our hands. Time is running out. We are going to do this surgery, but we could take an extra action to consult a disease specialist first. Now, the question is, do we have an extra time? So this is a little bit tricky. This requires a little fine-tuning of the rules, but basically when we get to 6 p.m. we read the status, but the rules do say if you're in the middle of something, first you resolve it fully. So the way I would read that is we can do this action. It will cost us a time, but then we would finish doing this surgery before we actually read the update. So I think we should. So we're going to spend an extra action, which is going to be the consult. And we're going to take story card 9. So let's see what the expert advises how much to cut off. Look at this. Come on, how cool is this? The infectious disease specialist says, as you don't know how long your patient has been infected. Yes, we do. Yes, we do. You won't know how far the necrotizing fasciitis has progressed until you actually cut into its flesh. I recommend taking a conservative approach. Okay, so, but we do know. We do know. Look at how cool this is. Okay, so look at all these reaction codes. All right, so luckily for us, we did the interview and we got some information. I asked Hemingway about his finger when we met at the beach this morning. Remember, he came in at 2 p.m., had hit his head 20 minutes earlier. Okay. He laughed and he told me he went crabbing yesterday and a crab caught him with its pincer. So we don't know what time yesterday. I don't know what time people normally go crabbing, but let's say the earliest he could have gone, let's say, was 6 a.m. and it bit him. 6 a.m. yesterday. And now it's 2 p.m. today. So that's 24 hours plus 8 is 30 hours, right? So he could have been infected now for 30 hours. 6 a.m. yesterday, 24 hours would be 6 a.m. today, plus another, yeah. 6 a.m. yesterday to 6 a.m. today. That would be 24 hours. We add 6 to get us 30 hours. That would be noon. So actually 32 hours. Right? So he could have been infected for a maximum of 32 hours. So given that he got the crab yesterday, it bit him 6 a.m. Doesn't say exactly when. No one else clarified the time of the crab bite, right? All right. Okay. So what have we got here? What is this trying to tell us? You don't know how long your patient has been infected. So if they've been infected 12 hours, you can do a different thing. But we think he's been infected for more than 20 hours. So I think that means we use this last row. No. Okay, that's weird. This is a little weird. It's not that we use this last row because it's been 20 hours. We use this last row based on what time it is. And we're in this time, we're in the second row since we're doing this early. Okay, so he's recommending we do items in this range here. So basically, since it's 4 p.m., we could do this one, this one, this one, or this one, with his recommendations being these two. I think that's how to read it. So it's 1400, so we look up this row. Our only choices here. Here are our 5 choices, and then based on what time it is what we read. And he's recommended that because it's in this time frame, we do these. Wow. So I recommend taking a conservative approach. What do you think that means? Okay, so for sure I'm amputating that whole hand. There's no question for me. I'm not just doing the finger. I'm doing that whole hand. Rob says it's 6 p.m. No, it's this period. We haven't quite reached 6 p.m. We're very close, but we're doing it as part of this action. So it's before 6 p.m. We're doing it as the 1520 action. We've just briefly consulted with this guy as an extra action. So we're not reaching the 6 p.m. So we're in this period up to sorry, this is 4 p.m., 1600. We're right on this second row, 1559. The only question we have to decide now is what to do. We don't know how far it's progressed, but we do know how long he's been infected, but it does feel like he's been infected for quite a while. So let's not get caught up with the chat stuff. Let's just specialize. Let's just focus on this. So a conservative action, it feels so arm to shoulder is too much, but I think we're looking at, we might get lucky if we amputate his finger. I think we'd be conservative, we amputate his whole hand. The only question is, should we be very conservative and amputate the arm to the elbow? Feels like that might be a little bit too much, and he's being conservative. So I think we're amputating that whole hand. I'm tempted to amputate the arm to the elbow, but I guess if we amputate the hand, he can still balance a little bit better. Debbie says, I think, let's do it this way. All right, let me read these comments here. Angie says, the specialist recommends a conservative approach. I'm not sure how, like, that's a little ambiguous to a non-medical ear, at least. I'm not even sure, like, I wish that was just spelled it out. He said, I recommend a conservative approach. Well, what do you mean? Do you mean be conservative and don't take more than you need? Or do you mean be conservative about the risk and take the most? So I don't like that. What do you think this means, take a conservative approach? And then Rob, if we do the surgery at 6 p.m., we choose HPE. Okay. Well, we're not doing the surgery at 6 p.m. I'm agreeing with Debbie. That's not how it goes. We decided to do the surgery at 15:20. It gave us an option as we did the surgery. It gave us an option to click off an extra time to talk to a consultant, but we're reading that as this is going to be finished before 6 p.m. So we're doing row 2. But now Angie says the conservative approach is to do the least as possible. So Angie thinks this expert is telling us don't take off more than you need to. This guy says, as you don't know how long your patient has been infected, you won't know how far it's progressed until you cut into his flesh. That's confusing. Is he saying, don't try to take off the whole hand because you'll start the finger and then you'll see if you need to do the hand? I really find this a little bit confusing, but maybe we're at a time crunch. We don't have time to argue with this guy. The question is the question is how to read this. First of all, how to read conservative, but more importantly, how to read this part about you won't know until we've cut in. Like, if we won't know, if we're going to find out when we cut in, why not just start with the finger and then we'll see if we have to do the hand? Why would you ever do the hand if you're going to be able to figure out on your own? Okay, Rob is complaining about the rules. Okay, can you forget about that for now? We're not talking about that for now. It's irrelevant. It's totally irrelevant at this point. We're talking about what to do. We can argue about what row to read later. That has no bearing on what we're doing here. We're discussing not game rules. We're discussing what to amputate and how to read the advice of our specialist. So if you read our specialist as saying that we should cut as little as possible because once we start, we're going to find out, then you'd say we should be on the conservative side and take just the finger. If you read him as saying, well, play it safe, be conservative, play it safe, and maybe you'll see how far it's gone, then you amputate the whole hand. Does he mean play it safe and be conservative, or does he mean take as little as possible and be conservative? This is a typical bullshit doctor. Like, this is so typical. This doctor's making $200,000 a year, $300,000 a year. Like, his whole job is give us a quick, clear answer that we can use. And instead he says, take a conservative approach. That's so typical. Like, how about you give us information without being misleading about it, without having it be interpreted in multiple ways? Andy says you can always take more later. You can't put it back on. The thing is, if we're wrong, if we don't take enough, then he could die. Like, it could spread. I suppose we could. We do have the antibiotics. If this was real life, I'd probably take his whole hand. A 70-year-old man with kidney disease who's not going to take the antibiotics well, I'd probably take his whole hand. On the other hand, his whole life is surfing. Feels like we caught it reasonably early. All right, let's try to keep this guy's hand. But we're going to watch him. If he doesn't get a lot better, we're taking that hand. Angie says, we need to manage his quality of life with his risk. He'll be severely handicapped if we take the whole hand. All right, well, we caught it early. We're going to take his finger. We're doing the surgery. If it looks like there's any chance, that the necrotic stuff has gone beyond the finger, then I'm just going to take the hand. But I guess we're going to cut into it and try to look. It looks like maybe it hasn't passed the last digit here. So I guess we're going to try to take the hand. The finger, I mean. All right, now does the group want to argue about what row? All right, I'm going to make my case. I know what I'm going to do, but I'll make my case here. We started the surgery procedure at 1520. When we did it at 1520, it said that we could use an extra action to take story card 9, which is what we chose to do. So we've used this extra action slot. The rules talk about what happens if you go beyond the slot here. Let's see. Let's see if the rules address this issue specifically. So at 4 p.m., we will read this update. The question is, we've chosen an action. It would be nice if the card that told us we could take an extra action was clear about it. But as I read it, when you're given a choice to do something else, it all takes place within that slot. There is a rule about this somewhere. Does anyone remember where it would be? It's not a free action. I don't consider it a free action. It takes up a slot. It's just, it hasn't quite gone into the next level here. You can see this says 15:59. That's where we are. We're still in that final time before it breaks over into here. But you could argue about it. But even if we had, well, we're doing the debridement. We're doing this action. So even if we had consulted first, then the debridement would be happening here. We have an extra slot in addition to the one. Okay, I think the chat is making clear. It's even easier. It's even clearer than I'm making it out to be. The surgery is being done at 1440. And then we've got consulting with an extra slot. So it's very clear. Even if we hadn't done the debridement yet, we could have consulted previously and then done the debridement. It would still be on this slot. So it's even clearer than I'm making it out to be. It's not even a judgment call. It's not even a judgment call. We've got 2 slots available before it hits 4 p.m. We could consult and then do the debridement at 15:20. We're actually doing the debridement at 14:40. So this isn't even a hard call of the rules. We don't even have to find anything in the rule. We've got 2 slots, one of which we're doing debridement and one of which we're doing consulting. You can argue that we've made a choice that puts the consulting at 1440 and the debridement at 1520. But no matter how you look at it, it's not yet to the 1600 slot. And it seems like we've finally gotten some agreement. Okay, that I can agree to. All right. So Angie says, I think this is an important detail. All right. So we're in an agreement, and actually you could argue that we are in fact in, yeah, we're still in the second row. All right, so 1400 to 1559, that's the second row. We're amputating the finger, that's ETG. Okay, let's hope this guy can survive, but we're gonna mark right across that top joint. If there's any question, take it. In fact, maybe we take a couple of fingers. Maybe we can leave him a couple or leave his thumb. But if there's any sign, we're going to try to take just the finger. If there's any sign of fishiness, off the whole hand goes. Card 26. All right, so let's see what we got. Card 26. Choose a surgical action as part of this action. Cross-reference the sheet. Cross-reference with the current time. Okay, so we're in this slot here. Oh, I see. He's advising this. This and this are the same cards. So if you hadn't consulted, if you didn't have time to consult, you would just get this with no recommendations. All right, so ETD is what we're looking up. We've written it down. Here we go. Boy, I hope this guy doesn't die because we didn't take enough off. That'll be a lawsuit for sure. EDT. ETD. Story card 23. As you cut away through skin and into Hemingway's tissue, the putrid smell of rotting flesh almost makes you gag. But you stay focused, working carefully but with speed. Finally, you complete the procedure. Exploring the flesh beyond where you cut, you see pink, vibrant, living tissue. You have successfully removed the infection. Phew. So we might not be out of the woods yet, but it looks like pink, vibrant, living tissue. So now he changes to state recovery. Now, there was something else that I meant to write down in my book in addition to the kidney disease. I wanted to write down back pain because we have checked that he doesn't have a brain trauma, but I'm a little bit concerned that he's also hurt his back. But we have to deal with the most important things first. All right, so we've treated his infection. We've amputated his finger as soon as possible. Hopefully we're going to save his hand. You complete the surgery with no further complications. As you pull up your gloves, you admire Hemingway's strength and unique lifestyle. As he sleeps, you go out to the waiting room to tell his friends that the surgery is a success and Hemingway is in recovery. If you have a card with this, take story card 19. I don't think we do. We don't have that symbol. We don't even know what it would reflect. What do you think that means? I guess we can look at it after we finish. Maybe this was either the newspaper article saying how famous he is. I'm curious what that newspaper article would have said. Or it could mean we took too long to do it. There he is. It looks like he's still, you can't see if he's got his hand. Okay, so he's in recovery, but the game isn't over yet. Now we've got this new card. So we have to decide if there's other stuff we want to do. Now he's got a kidney problem. We could do dialysis. I don't know if that's called for. We could do an MRI on his brain to see if there's microbleeding. Or we could do a test of his spinal to make sure that he doesn't have a back injury. Oh, the update. Thank you for reminding me. Now we do the update. Okay, so we've gotten him to this state. So our 4 p.m. update is ZMR. I really wish there was a place to put this ZMR. Okay, let's do it. Thank you. Let's see what we've got. ZMR. Bungie is sitting with Hemingway when you enter. Thanks, man. I knew that crab did him wrong. You confirm that Hemingway's condition continues to improve. However, that makes it difficult to assess the causes of his other symptoms. You consider reviewing his chart to confirm you addressed everything. Okay, so it's a little bit of a hint that he may have more issues. Now, I want to point out that he's got leg weakness. We think this is probably from the infection, but what about his sore back pain? I really wonder if he didn't hurt his back. We didn't talk to the guy who saw his fall. I do think it's unlikely that you would hurt your back in the water, but on the other hand, he's 70 years old. So I think maybe we may want to do an MRI, a spinal MRI, or a blood test. Now, what's the dialysis say? I mean, we have given him stress to his kidney. Dialysis, toxin from blood during kidney failure or in people whose kidneys can no longer perform these functions. Huh. So I wonder. Yeah, I wonder. Dialysis seems fairly harmless. I'm tempted to do dialysis and spinal MRI to check for back injury. The other option would be to talk and ask the remaining questions we never asked from our interview. The newspaper and the fall. We could test his blood for kidney failure instead of just doing dialysis. So a blood chem 7 would test for kidney function issues. All right. I think that's reasonable. I guess I'm more inclined to just give these people their treatments as a preventative, but the channel says do the test first. Angie says, I looked up ataxia. I think we do the nutrient panel to test for vitamin deficiency. I don't know about that. That just seems like a minor thing. I mean, I think there is an entry here on his carnivore diet, but I just don't see how that's enough. Like a nutrient thing, like, yeah, maybe he's low in nutrients, but really, carnivore diet, red meat, poultry, fish, and eggs, 0 carbohydrates, no vegetables. I mean, he may have a vitamin deficiency, but that's not our concern at an emergency room. But Angie says we should read about ataxia. Okay, let's read about ataxia. Poor muscle control, voluntary movements may affect walking, balance, can be caused by alcohol abuse, stroke, tumor, certain medications, and he's got ataxia because he's got this infection that's causing his whole brain to shut down, his whole body. That's our sepsis. I mean, it doesn't say it causes ataxia, but his legs got weak. I mean, surely that's the infection, not nutrients, not vitamins. Okay, I'll tell you what we'll do, though. We'll take an 8-minute break, give some thought. I'm leaning towards doing the kidney function blood test and the MRI spine check, and then probably doing dialysis on him. We could do the MRI to look for microbleeding too, but I don't think there's anything to be done about it. So I don't know. Don't do a test if you can't do anything about it. But let's take our break. I'll see you in 8 minutes. All right, so we've stabilized our guy. We've treated the main problem, which is a bacterial infection in his hand. We know that he's got chronic kidney disease, and we fear he may have some other issues going on. The clear indication of what we haven't treated is his weak legs and back pain. If you look up ataxia, it's fairly generic. Poor muscle control, clumsy voluntary movements, may affect walking balance, can be caused by alcohol abuse, stroke, tumor, brain degeneration, certain medications. I was a little concerned that he hurt his back during the fall. But if you write down the things that we're concerned about, we think stress to his kidney. Does he need dialysis? And if so, the chat is very hot on us doing a blood Chem 7 test to find out first. And then we were told also that we could do an MRI of the brain. One of the experts suggested that for bleeding. That didn't show up in the CT scan. And then if we think there might be a spinal injury, we could do an MRI on the spine. And then we have questions we can ask. So these are options for us. Blood chem, MRI brain, MRI spine, and questions. Now, the MRI for the spine, that was suggested to us by one of the brain health things. So he was saying the CT showed nothing, but our guy said, well, maybe you want to do an MRI on the brain because of microbleeding. So let's just read this for a second. Can be caused by head trauma, other causes, confusion. As long as the patient's cognition improves and blood pressure is stable. We haven't had any sign of the blood pressure changing, although it is, we think, low. There is no need for treatment. They resolve on their own. But some cases you need to do surgery to drain blood from the brain to create room for the hematoma. Avoid medications could lead to stroke. But I think we would have found all of that if we did a CT scan. So I'm less concerned about that. I mean, maybe we want to reread what that CT scan showed. Here's what the CT scan response said. He said, I assume you're concerned about a hematoma, but he says, don't worry about it. It looks normal. But he could have microbleeds if you want to be sure. That seems like pretty low priority to me. I don't think I have much interest in that. Now, I did read something interesting, though. I think kidney is right for us to focus on. There's some concern in the channel about doing a nutrient test. That's very low priority for me. But something was interesting that I saw. Like, I don't know if we should be concerned he may have also had a stroke. But when I think it was chronic kidney disease, so I think they're actually interesting symptoms. Let's look at chronic kidney disease, which we know he has. Conditions where kidneys are damaged over time and lose the ability to filter waste may lead to kidney failure. Now look what it says. Waste buildup can cause high blood pressure. Well, he doesn't have high blood pressure. We think he has low blood pressure, but blood test. I think I saw something else. I thought I saw kidney failure. Stress on the kidneys. Treat with IV. We already give him an IV. Inflammation of the kidney due to a bacterial infection. Frequent urination. Flank pain. He's got pain in his back. Maybe that's indicating it was near the flank. CBC and fever, which he has. CBC blood test will show WBC. Treat with antibiotics. All right, well, we've already given him antibiotics. I thought I was reading somewhere about kidney problems causing movement issue, but it doesn't look like it. Can we all agree that perhaps the best thing to do is a Chem 7 now, which is specifically going to look for kidney function issues? It's not an infection we want to find now. We've already found the infection. We want kidney issues. So we're going to do a blood test Chem 7. That seems like the thing to start out with. We think he's still got problems. Let's see if it's kidney. Okay. So blood test Chem 7 on his recovering card. It's 1600, so YJQ. YJQ. His creatine level is higher than normal. Well, that's not that informative, is it? I mean, we are told that that's kidney damage, but isn't that to be expected? A blood test will show higher levels of creatine. Creatinine. But we already know he's got chronic kidney disease. I mean, I was hoping it would be more specific, like, are they in acute failure? I mean, the question is dialysis called for as a preventative just in case? I mean, the kidneys haven't failed. We've already given him an IV. Let's take a look at our options here. We've written down our thoughts. Let's take a look at the official options. I mean, you could argue that he's going to get better and a nutrient test would be a good idea, but boy, that just seems so minor. Like, that's something you do maybe at the very end. So, boy, that MRI one, he says, I suppose you're concerned about hematoma, and he says not to worry, But he could still have little micro bleeds. But surely if they're micro bleeds, we don't need to do severe treatment. So our options here are we could just send him for dialysis because his kidneys are weak. We could do a nutrient test on him. We could do a spinal test if we think he might have hurt his back, or we could talk to can interview our subjects. Nelson says, I don't think we need dialysis. It would have told us, I think. I have a hunch reading the vitamin booklet. Let me know if I can share. Yeah, go ahead. Let's hear what you think you've got about the vitamins. He's on a carnivore diet. Excludes vegetables. So on a strict carnivore diet. We know he's got muscle, weak pain, but muscle fatigue. I mean, fish oils are high in vitamin D, so I would think he's got plenty of vitamin D's. I just seem so crazy to be worried about his nutrients. He's doing fine in life until he got this infection. I'm not saying it might not be in the game. It's just, it seems so unlikely in real life. Okay, potassium, functioning of muscles and nerves. Food high in potassium includes beans, lentils, tomatoes, potatoes, soy, and squash. High levels can lead to hyperkalemia. Hyperkalemia. What is hyperkalemia? In case your potassium level is high, very high, can cause heart problems, require immediate medical attention. I mean, just not ruling it out. It is very suspicious that he's on this carnivore diet. I just think, my God, emergency room testing for nutrients, it just seems so small ball compared to what's happened. No matter what that nutrient scan shows, it doesn't feel like it can be that important to us. Shouldn't we be more concerned about an MRI? On the other hand, maybe we've solved him from the main problem. And now we're in the easy stuff. Debbie says he collapsed for no apparent reason. We should be careful to rule out any other causes. He collapsed because he was about to die of a bacterial infection that had given him a fever and I mean, all his vitals are fucked up. He's got a fever, high. Can someone Like, I don't like that this doesn't tell you when they're high or low. It seems like that would have been a nice, easy thing to show what normal is. Stage 3 chronic kidney disease. That sounds serious. I just would love to know if these values are what they mean. Seems like it wouldn't have killed them to give us some summary of how these are abnormal. Well, what do you guys want to do? Why don't you let me know specifically what you're thinking? You got seems like a bunch of people in the channel want to test them for nutrients, a nutrient panel test. From a game perspective, it seems reasonable. It just doesn't seem reasonable from a real world perspective to me. This says regular heart rate. This says regular heart rate, and yet here his heart rate is set at orange, meaning it's abnormal. So that feels like a contradiction here. Normal heart rate is 60 to 100. So his heart rate is elevated. Normal RR is 12 to 20. So I guess he's breathing heavy. Maybe this oxygen should be at 100%. So he's getting a little less oxygen. Looks like 2 people want to do a nutrient panel on him. All right. No one else is suggesting anything. No one else is concerned about his spine other than me. We did a Chem 7, which suggests kidney problems, but no one else thinks that means we should put him on dialysis. Okay, we're going to do nutrients then. I'm doing this for the channel. Nutrient, I'm not strongly opposed to it. I just feels like I'm worried about, like, someone comes in with a confusion and a concussion and we're doing nutrient tests is a little odd. But okay, we're doing a nutrient panel test at 1640. So NNV. Just have a hard time seeing how significant it's going to be, but maybe. Maybe we found the important stuff and now we're just doing the little cleanup. NNV. Story card 11. Hemingway's vitamin C is shockingly low, where normal reading is between 0.3 to 1.9. Something is wrong. Vitamin C is scurvy. Why would his vitamin C be so low? That's interesting. That is not what I expected. Vitamin C, nutrient needed by the body, help with healing and forming blood vessels. Healthy diet, fruits and vegetables usually provide all the vitamin C. Low levels can lead to scurvy. Can we learn about scurvy? Scurvy caused by severe vitamin C deficiency, anemia, leg weakness, fatigue, irritability, bleeding gums. Didn't we see on his thing that he had swollen gums? Vitamin C supplementation, altered diet to include more fruits and vegetables. Okay, so I guess that was it. That was important. This does feel like not a critical thing, but let's give him his supplements. Hopefully he doesn't have a spinal injury. But okay, we're going to give him a vitamin supplementation. He's got scurvy somehow. So, vitamin supplement, which is AKC. Okay. Story card 14. There's a lot of story cards we haven't seen. The following vitamin supplements are available. Choose as many to inject as you like. Mark all your choices. Look up the result. So I guess the result's going to be like, just wait and see. Now, we did a full nutrient workup, so clearly I mean, I think this is just generic information. It's telling us all he needs is vitamin C. So is there any reason to give him anything else? He doesn't need it, right? Just vitamin C, don't you think? So WUF. Right? We're not going to give him stuff just for the hell of it. I'm going to look up WUF. The chat has some ideas of other vitamins to give him just for good measure. You can let me know. WF is story card 16. Oh, that's a bit of a surprise that there's a card. If you've given Hemingway a vitamin mineral supplement, you've given him a supplement. Okay, so here's this card that, remember, it asked us to check for before. We didn't have, now we have it. If you have revealed a card with the Band-Aid, I think this is the card we did reveal. This is when we amputated his hand. So I think maybe, is this going to say now that he's fine? Like we've done the hand and we've done his vitamin deficiency? Story card 19. Yep. Congratulations. Hemingway has survived the night. You have uncovered and addressed two major health problems that threatened his life. He's currently resting and recovering. All right, good work on the team for figuring out we should do a nutrient scan. Story card 38. If you like, you can keep working with Hemingway until you're ready to complete your final report. What was the cause of his symptoms? What treatments did he require? What recommendations do you have for him? So we've got him through the night. That's good work. Now, we haven't gotten our score yet, so perhaps we shouldn't be so quick. So actually, we did very efficiently with this guy. However, there's a big stack of cards we never saw, and we still have some time with him. So I think we're not quite done. I think now that we have a little bit of time, what we should do is we should maybe do that brain MRI just to see if he's not microbleeding, although I'm not sure what treatment we would give him. But let's finish up doing some interviewing here. I guess we have to read this update. His status hasn't changed. He's recovering. It's the 8 p.m. update, SNS. It's Seagull who is with Hemingway this time. She gets up when you enter and takes you aside, speaking low so Hemingway can't hear her. She holds your gaze with her serious eyes. You almost feel intimidated. Is he going to be all right? I've never seen him this week before. Are you sure you've caught everything? You tell her you and the hospital staff are making sure Hemingway is fully fit before you release him. It's just vitamin C. He's got scurvy, like an old sailor. Tell him to eat his vitamin C. All right, so that was our update. No big deal. Now let's ask a couple questions about the newspaper. Question 1, and I guess while we're at it, we'll ask about the fall BRW just for fun. Or do we want to hear about his history of his missing arm? I guess let's look about the... I guess we don't really call... I guess the fall could tell us that he hit his back, and then maybe we'll be more serious about that. Okay. Saw the fall. Question 1 and question 2. I'm kind of curious to hear about his arm, but let's go ahead and do this. Newspaper is XFV. If you have other things you want me to do before time runs out, now is the time to say it in the channel. BRW. We're just tying up some loose ends here. XFG. XFG doesn't exist. What is it really? XFE. Story card 3. Okay, so we're asking about the newspaper article. Bungie seems quite distressed and waves a newspaper in your face. You gotta read this, Doc. Hemingway is always talking about how good crabs are for you. You know, they're high in protein, almost no carbs, lots of those good omega-3 fatty acids, vitamin B12, C, folate, calcium, potassium. His voice trails off. I think he's been poisoned. He thrusts the newspaper in your hands. Take card 3637. If you like, it's your second question. Bungie can check the online Red Tide update link and share what he finds. No, we don't need that. Wow, he gave us lots of information, though. Let's see what 36 and 37 are. Look, here's the article. Crabbing season off to a sideways start. Neurotoxic shellfish poisoning. We see this every year. That's pretty cool. Crabbing seasons. It isn't the crab that gets them sick. The toxins are not absorbed into the edible tissues. Breaks open their little cells, release toxins into the air. No death by NSP. Food poisoning, stomach pain. So I guess you would realize from this that maybe he doesn't have symptoms of the toxin poisoning. So that was a little bit of a red herring. And then question 2 was BRW. Story card 4. This is the guy who saw the fall. Flipper looks like he just got off the set of a surfer movie. It scared the bejesus out of me when I saw Hemingway go down. 1 minute he was tall, tail sliding a wave, then I saw his knees buckle from under him. He collapsed on his board and hit his head. Flipper stops and bites a knuckle. I've seen him wipe out before. He always gets back up. There's something clearly wrong with him. There's no way he'd just fall down. No way. Flipper runs his hand through his hair. You gotta help him, Doc. Surfing is his life. All right, not very much useful information there. Let's see if the chat has any final requests. Trepanation is a possible treatment for microbleeding. We should check if there is any first and if it's serious enough to need treatment. If there are microbleeds, that could become serious. We should do the MRI before discharging the patient, and Debbie agrees. Okay, so you guys want to do a brain MRI. The only thing we're not doing is a spinal MRI. It makes me a little nervous, but let's do it. Brain MRI, we're at 1840. We're in the last period here. 1840 MRI of the brain, FRH. FRH. Okay, let's see what the brain MRI says. We won't have that much time to treat it, but we do have time to treat it if we need it. FRH, story card 21. The neurologist said, well, look at that. Nice catch. You can see the signs of cerebral microhemorrhaging. Fortunately, he doesn't need treatment unless he develops a hematoma. So this was kind of what I said, right? Like, even if he's got it, there's no treatment. There's nothing to do. So, I mean, I guess we just tell people to keep an eye on him, but that's what we would have done anyway, right? So that's consistent with what we found here about microhemorrhages. There's no treatment as long as his blood pressure is stable. I suppose maybe it's useful to know because we put it on his chart, and if his cognition doesn't improve or his blood pressure drops, then we say, okay, re-image the brain. It's maybe that this has gotten worse. So I guess that was just confirmation of what we thought. So I'll tell you what I'm going to do. Since I think we are done, we have one more time. I just want to do an MRI scan on the spine. I want to make sure that there's no spinal injury during the fall that could be undiagnosed because of these other symptoms. So I think as the last test, I'm going to do an MRI on his spine. I mean, what's another $10,000 on his bill? He won't live long enough for them to collect it, right? He'll be way dead before the collection agency gets this money. LM MRI spine. Now, before I do this, let's just look at this. Let's make sure there's nothing else we want to do. Maybe if we x-rayed his legs, we would find a break, but I'd rather do the spine. If his legs are, if he broke a leg or a toe, he'll find that out when he wakes up. I just don't want him to have a spinal injury where we're moving him around. And we've definitely decided not to do dialysis, right? That would be the only other thing we could do for safety reasons. But he's feeling well. I think we're okay. We're just going to do an MRI on his spine just to make sure. LMX. The spinal MRI comes back normal. In fact, Hemingway's spine looks great for a person of his age, history, and level of activity. Okay. So it's time to write our final report. All right, where is our card reminding us what they want us to solve? Okay, here we go. Now, what caused the patient's symptoms, we're going to say one was a bacterial infection, and that was the Vibria. Finger. 2, he had scurvy. What treatments? So he got antibiotics of a very specific type, which I guess we're going to be scored on. And we debrided and amputated his finger. Hopefully we caught the spread of that. And then vitamin C supplement. Okay, recommendations. Eat fresh fruit and vitamin C supplements. 2, we're going to say return to ER any sign, finger or blood pressure or confusion. Anything else? Another recommendation, maybe antibiotic ointment, Band-Aids, and clean wounds. I guess just in general, clean wounds and gloves when you're cleaning the crabs. I guess all of this just is clean your wounds. Recommendation, clean wounds and gloves. Any other recommendations we want to make? So we've basically diagnosed him with the Vibrio bacterial infection on his finger and scurvy, lack of vitamin C. We've prescribed specific antibiotics, which were doxycycline and sima whatever. We've debrided and amputated his finger. Actually, we've given him a vitamin C supplement. I guess we gave him an IV as well. And then as far as recommendations, he can keep eating his carnivore diet, but he's got to supplement it with vitamin C or some fresh fruits. Keep an eye on that finger and confusion like a hawk. I guess with number 2 has to be like, with number 2 has to be stay near friends. Like he'd be able to spot his own finger reinfecting, but he's got to stay with a friend to monitor him for confusion, right? Nelson says, remind him also to complete his antibiotic cycle. Good point. Okay. Anything else? Anything else to tell Mick Hemingway Irons? All right, you got a minute to come up with anything before we move along. His spine's in great shape. I think he's okay. All right, let's go ahead and read our solution envelope, our epilogue. Here we go. Sometimes there's so much going on, it's difficult to discern what's important. Hemingway has many symptoms. All the help his friends offer just adds to the chaos. You could start with Hemingway's head trauma. If you had reason to, you could run a brain CT scan or MRI and discover that Hemingway has cerebral microhemorrhaging. However, this condition doesn't usually need treatment. Hemingway likely has a concussion, which means he just needs rest and monitoring. So I guess it's saying we shouldn't have even bothered with the CT, because if that was the case, he still wouldn't have any treatment. You could give Hemingway something to relieve his headache and discomfort. However, it's important to know if there's an underlying cause to headaches. If you run a brain MRI, you discover Hemingway suffered cerebral microhemorrhaging when his head hit the surfboard. Typically, this is not a problem unless you prescribe aspirin because it increases the risk of bleeding. Because of that, with Hemingway's fragile condition, it would cause a hemorrhagic stroke. Yikes. Hemingway would need a blood transfusion to replace the blood he loses from internal bleeding. Vitamin K helps the blood to clot, helps to stop any internal bleeding. Acetaminophen would be the safer headache medicine to prescribe. Next, you could x-ray Hemingway's legs to see if that sheds any light on why he fell. It doesn't. So why did he fall from his board? Perhaps he had a case of surfer's myelopathy. He's hardly a beginner surfer. Or neurotoxic shellfish poisoning. However, crabs don't absorb NSP toxins into their edible flesh. See Bungee's newspaper article. Hemingway also shares his crabs, so others would have gotten sick as well. If crabs were the problem, we noticed that. In any case, the shellfish toxin, while uncomfortable, is not fatal. Hemingway's diet offers some clues. He eats no carbs, meaning no fruits or vegetables. And since crab season started yesterday, see the newspaper, Hemingway has no source of vitamin C. I guess those feel like non sequiturs there. Maybe that's a period. A nutrition test reveals he's low in vitamin C, a condition leading to scurvy. A vitamin C supplement will help Hemingway tremendously, as will a consultation with a nutritionist about the hazards of the carnivore diet. I guess maybe we could have sent him to a nutritionist, but in today's modern day, just read the internet. Which finally leads us to the cut on Hemingway's fingers. Sometimes the small and seemingly insignificant issues are actually the most critical. While Hemingway has many antibiotics isn't enough. That's because he went swimming in the ocean with an open wound. Either consulting the infectious disease specialist or running a tissue culture will reveal Hemingway has been infected with Vibrio vulnificus, and it has progressed to necrotizing fasciitis. You should first prescribe doxycycline and ceftazidime. If you prescribe ciprofloxacin, you'll discover, combined with Hemingway's pre-existing chronic kidney disease, it will trigger renal failure. His kidneys will fail. You'd have to put Hemingway on dialysis to save his life. However, that delays you from addressing vulnificus. A couple things we could have done today that would have sent him into some serious trauma, so we avoided that. That's the problem. This flesh-eating infection is eating Hemingway's remaining arm from the inside out. The longer you take to act, the more damage it causes. When you debride the dead flesh, you must decide how much of his arm to amputate. There's no easy right answer to this question, even with the help of the infectious disease specialist. However, to avoid cutting off more than you need to, you could amputate his finger or part of his arm to see how far the infection has progressed. If you didn't amputate enough, you'd have to cut more. In this way, you can avoid amputating more than you need to. If you didn't amputate enough, you'd have to cut more. Okay, let's look at our score here. First, 40 points if he survived, 60 points if you discover he has scurvy, 10 points if you gave him vitamin C, 5 points if you gave him acetaminophen. We didn't do that. 20 points if you debrided a portion of his finger to save his life. 10 points if you recommend dietary counseling or tell Hemingway to abandon his carnivore diet to work in more fruits and vegetables. Well, we told him to eat more fruits, so I'm going to give us those 10 points. 5 points if you notified the CDC about his infection. Failure to do so could result in others being infected. So we missed another legal test. We need to remember to keep reading those legal things. We lost points last time we played on the last box for failure to doing stuff. All right, so what have we got here? 40 plus 20 plus 30, 70. Then we took off his finger. That's 90. I'm going to give us 10 points for recommending fruit. That's 100. We didn't notify the CDC, so we lost 5 points for that. All right, so we got 100 on our first part. Okay, let's look at the second part. Minus 3 points if you gave him vitamins he didn't need. Wouldn't hurt him, but it's not necessary. Minus 5 points if we gave him ciprofloxacin. You just lose 5 points if you triggered kidney failure? That seems so weird. We get 10 points if we recommend he goes to a nutritionist, but we lose 5 points if we triggered renal failure. Something's a little off about that. 5 points if you didn't put him on dialysis once he had renal failure. Okay, but we didn't cause renal failure, so we didn't have to put him on dialysis. Credit to the channel that kept me from putting him on dialysis when he didn't need it. Minus 10 points if you amputated more of his arm. So if I had amputated the whole hand, maybe we would have lost 10 points. So actually we have 100 points here. That's our score for today. 100 points. We lost 5 from not telling the CDC about vulnificus infection. Seems like people are dying all the time from this vulnificus, so I don't know why they need us to tell them, but I did give us credits for the recommendation. We also lost 5 points for not giving him a headache medicine. I don't agree with that either. I don't think you shouldn't be giving people who are about to die Tylenol. They can live without it. This is a tough old guy. He served in Vietnam. He lost his arm. He doesn't need acetaminophen. That's not the kind of doctor we are. We're not the kind of doctor who just gives people pain medicine just in case they're uncomfortable. Tough it up. Tough it out. This old man, he can tough it out. He's Hemingway. He doesn't need acetaminophen. All right, so let's read the solution, the final thing, which is QBI. QBY is story code 33. Okay, here's our story finale. I don't think we did debridement. We absolutely did debridement. That was the action we chose, which let us do the surgery, do the amputation part. But this entry here is for debrided, amputated. It's the same thing. We did that. Okay, here's our final thing. Looks like I owe you my life, he says, his voice like gravel. You owe your life to your friends, you say. He smiles. I've dodged death more times than I deserve. He looks at the bandages on his right side. His smile doesn't falter. It doesn't matter how rough things get. You get to choose the waves you ride. I don't know what the future holds, never have. But I decide now how I'm going to live it. And you've got us, says Bungie. The surfers all start talking, making a ruckus as you leave the room. How cool is that? Okay, so there's our case, 100 points. Can't do too much better. However, we've lost points once again for not doing legal filings that we should have done. I am guessing that if we have a supervisor, they are going to suggest a remedial legal course for us. Certain infections such as cholera and vibria must be reported to CDC. That's too bad we didn't catch that. I would have liked to gone home, had a glass of champagne, and remembered and celebrated that we remembered the legal part of things. Let's make sure in our remaining cases that we check that those legal requirements before the end of the case. All right, so we're going to talk about that case in a minute, but let's do this first. Let's scan through these, then we'll take a very short break and we'll talk about what we thought of this case. But let's see what we've got with the cards we didn't see. Okay, emergency. If we had done something. Wow, this is either if we gave him aspirin and he had a stroke or kidney failure. We could have talked about his missing arm just to learn that they love him and he's had a hard life. You gave him a vitamin mineral supplement. I feel like we did do that. I wonder if we failed to draw a card for that. Oh, that doesn't look good. He screams and grabs his head. He just had a stroke, a hemorrhagic stroke from the aspirin we gave him. Wow. Oh my God, he died. Wow. He just died straight off. You can take it. So this is if we consulted with the neuro specialist. This is if we saved him after we triggered a stroke, if we did the right thing to save him from that stroke. Here's another way he could die. Heart beating slower and slower. Not sure what we did to cause that. Maybe renal failure. So if we tried to debride just a little, go back to story card, choose another action, cut away more than you already have. I see. So if you hadn't, I guess here was the game mechanic. If it was late in the day, and you said, like, oh, just try to do a little, it would have said, you found worse, now it's going to take you an extra time click to do the proper thing. Wow, if it's time to do an update, check the update first. Okay, so if you choose too little to take off, you waste time. So we chose the right amount. Okay, this is if you decide to do a trepidation to relieve swelling in the brain, but you realized it and you did it. You cut into his skull, but there's no pressure. Whoops. You didn't need to do that. This is amputation. I feel like we did that already. You're thinking about toxins, and there's a special urinalysis test you could write. So there wasn't an entry for urinalysis, but if you do a certain thing, you think it's toxins, it lets you. I guess we had a choice to talk to an infectious disease specialist right at the beginning. So if we had gone there, he says, I think it's Vibrio vulnificus. So the expert could have told us without the tissue sample. And here it is, if we give him ciprofloxacin, we send him into renal failure, and he dies if you don't do dialysis. Do you think he might be in kidney failure? And this is if you save him from the dialysis. And this is if you run out of time. Okay, we've seen all the cards now. What we're going to do is take a little 3-minute break. We'll come back. We'll talk. Actually, it's been an hour, so we're going to take a 5-minute break. We'll come back. I want to hear your thoughts on this case. You've just watched our playthrough of Patient 2 of Medical Mysteries Miami Flatline. We're going to now talk about this case. I can see there's a little bit of an issue with the comments. For some reason, we're not seeing the comments appear on the intermission screen as we usually do. Yes, I can see that something went wrong with my plugin that connects to the chat. I'm not sure exactly why. Thankfully, it doesn't affect us here. Nelson says, I think the experts in this game are like the Sherlock Holmes consulting detective friends for hints. Yeah, I think that's right. Although I seem to remember in the first box that they weren't nearly as helpful. Here it seems like we could have benefited from them. Another great case with excellent puzzles and traps on the way. Luckily, we avoided them. It seems this time we could lose the patient. We absolutely could. Minor thought is that as we get more experienced, metagaming is a little too evident. I wish we had a larger set of options on each status card and a larger booklet. Yeah, I think that's a fair point. I love how this game has ways you can make mistakes that trigger a very high-stress situation, but almost always ways for you to then recover from it. But if you're not careful, you will lose the patient. So it's almost like the game lets you be careless enough to get your patient almost dead, but then it tells you how serious it is, so you really better take the time to figure out how to save the patient. We did quite well in this case. I feel like we very quickly did what we should have, and then it's interesting that this case didn't reward us for doing the CT scan first, which I thought it might, but it kind of said you didn't need to do it because even if he had a serious brain trauma, that there would have been no treatment. But I think I disagree with that. I feel like in other cases, the game has been like, yes, he didn't have a hematoma, not a hematoma, he didn't have a brain pressure bleeding, but it seemed to suggest that we didn't even have to do that. But I don't think that's right. If we had seen extreme swelling in his brain, we would have had to do a trepanation. A trepanation, not a trepidation, trepanation. So I feel like the game should have given us points for doing the concussion checking MRI first, even though it turned out not to be the case. But then we quickly zeroed in to the wound on the finger. I feel like we played this fairly efficiently and then cleaned up any last possibilities. Thanks to me for figuring out what antibiotics to give him. Thanks to the chat for figuring out we needed to do a nutrient panel on him. I'm still a little skeptical about that, but that was more like after you've solved everything else, you might as well do a nutrient scan. I think one of my favorite elements in this game was, in addition to the antibiotic contraindication, figuring we shouldn't do that, the other thing I particularly liked in this game was that moment where it says, okay, you figured out there's a bacterial infection in his finger, and now how much of his finger do you want to cut off? That was pretty damn cool. They're like, okay, you've got this very serious problem. Now, what should you do? Now, if we had said we wanted to cut off, let's say, if we had gone, we choose to just amputate his finger. What if we had amputated the arm to the shoulder, WLM? What would the game have told us? It says, take story card 24. So if we had amputated all the way up to the arm, One of the most difficult parts of an amputation is you have to remove some living flesh to ensure you get all the dead. Leave any behind, it can continue to spread, eating its way further. As you lay the scalpel down on the skin, you wonder if you're cutting away enough. So no matter what you cut, I guess if you don't cut as much, then it gives you this card. You remove the infection. But it gave us this card, which we didn't get when we just took his finger off. And then the idea here is that because we drew this card and we amputated up to the arm, we would have lost 10 points because we took away more than we needed to. So we made a good decision there. I'm not sure, though, if we had taken off the hand, if we would have gotten penalized. So instead of the finger, if we had taken off the hand, we would have gotten BDM. Story card 24. So yeah, if we had taken off the hand, it would have said that was too much. So we actually did perfectly by just taking off his finger. Really, that is the shining star of this series, the tension. The psychological tension of making a mistake. I guess we shouldn't say just tension. The star of this box, of this series, is that you're dealing with actions and the consequences of your actions rather than just this detached detective work. And boy, is that cool. And then the little details here about how we're talking to his friends and we get this little epilogue. I mean, that was a good case. There's always multiple symptoms, multiple causes going on. So just when you get out of the woods, you think you're out of the woods, then there's a little bit more. Debbie says, I think we actually did better on this one than the first. We avoided any emergencies. Yes, that's true. I think it was just saying there's no serious brain injury in this case, but we definitely needed to do that test. That's why I think it should have rewarded us. Like if you had played this game and never done a CT scan, never looked at his head for trauma, you still would have gotten a perfect score. And I feel like in the past, the game has been more clever about rewarding us for doing good tests, even if they weren't even if they didn't turn out to be the cause. Debbie says nutrient issues can be serious. I know a few people have suffered from them in real life. Angie says, can you check what would have happened if we only took off the dead tissue? I'm just curious. Okay, that's an interesting point. I think we saw that card. The card said you have to go do it again. So if we had only done this NHR, there's a separate card that says you need to waste more time and go back. I'm pretty sure we saw that card. So let's just look at it. So if we took NHR, we'd get story card 23. Actually, 23 is the successful one. Oh, maybe that's because of when we did it, though, NHR, if you caught it in the morning. All right, if you caught it late and you tried just to remove dead tissue, let's do PWH. So if late in the game, you said, just debraid the finger, don't even amputate it. Then you get PWH, which is story card 20. Yeah, so if you had done that, if you had just tried to remove dead tissue around the wound, if you just tried to debride it, here's what it says. You carefully make your cut into his skin, then deep into his flesh. However, it's clear the necrotizing fasciitis has progressed faster than you anticipated. You can't tell how far, but you're going to need to go back and do more. So it says you've completed this action. Now go back and make a new decision. So every time you underestimate how much you have to take off, you lose one of your slots. So, but Debbie says we should check this for our slot to see if we could have gotten away with not amputating the finger. All right. It doesn't make the slightest difference to me if we could have gotten away with it. That would have been too risky. So I'm not going to have any second thoughts about this. But in case you're curious, YGD is 20, not enough. The 20 card is the not enough card. So if we had tried to get away with being not taking off more, we would have wasted a time. Okay. Pretty amazing. Now, here's the interesting thing about this box. That was case 2, which was a hard patient. I believe that's as hard. In fact, I'm not even sure that the first box ever got up to hard cases, which I would disagree with. I think the first box had cases that were at least as hard as this one. Regardless, our next game seems to combine patients 3 and 4 and is harder. The hard part is not important for us to discuss, but what is important for us to discuss is this 3 and 4. So I think what I'm going to do is we're going to look at the outside envelope for patient 3 and 4. Okay, now let's read this. This is what's up next for us. Please note this patient is played in combination with patient 4, John Doe, as the 2 patients arrive at the emergency room simultaneously. This doubles the game duration compared to a 1-patient game. Your next patient is Senator Carmen Perez. She's a busy woman in the middle of a re-election campaign, thinks there's something wrong with her heart. The hospital's very short-handed today. She has very little patience. Quickly open this envelope, check the contents, leave the epilogue sheet in the envelope. You will also need the result caselet booklet and the 4 research sheets from the codes. So it doesn't tell you to automatically get the next patient, which is in the box. But it does answer my question about whether you could play it as 2 separate games. And the answer is no. They're both arriving, and we're going to have 1 double-length game. Today's session took us 3 hours and 40 minutes to play and talk about. So the question is when we're going to play patients 3 and 4, and we're going to play them in the same session, although we could always split it up. But basically, we should plan on 1 big long block of maybe 6 or 7 hours, probably 6 or 7 hours, either in 1 session or 2. So we'll have to decide when to do that, but maybe next weekend might be the best bet for us, keeping at the same time, maybe 1 p.m. on Saturday, something like that. Maybe we'll discuss on the Discord or the Board Game Geek Guild for this forum. If you watch this after the fact, I'd love to hear your thoughts. If you want to join us for Patients 3 and 4, you might stop by the Board Game Geek Guild or the Discord for this channel to help coordinate when we do that. Playing them next week, and depends if we need to get back to our Dear Homes schedule, and that might be on Sunday. So I don't know if that's going to be a problem for us. Maybe just 1 big long Saturday broken up into 2 parts. We can figure that out next week. Thanks again to the Patreon supporters of this channel that made it possible to pick up this game, to purchase it for a little more money from overseas and get it a little early before it has officially released in the US. Thank you to everyone for all your help in saving this patient. So far, so good, but let's not get complacent. That's how we got into trouble last year. And now we got a senator. That could be our career on the line if we mess this one up. All right, I'll see you guys next time.